Hey, it's Dr. Erica Jones here talking to you about poverty and healthcare. Seems to be the big elephant in the room, but I'm going to let you know what's going on. A lot of people are sick because they don't have money, okay? So when we talk about poverty, it's important to understand that poverty is a very significant determinant of health, and it has a profound impact on healthcare access and outcomes for people who look like me, Black individuals. Now, you let me know if you know, but Black Americans are more likely to live in poverty than our white counterparts. And this is a true disparity. It's associated with so many different bad health consequences, so many different chronic diseases. And a lot of times people don't even think about the link in between poverty and healthcare. So that's what I'm talking to you about today, right? I want to help you kind of form this link and form this bridge in your mind so that you understand what Black people are dealing with when we're trying to access healthcare. One of the main ways that poverty affects our healthcare is strictly limited access. You know, uh, it's difficult for Black Americans to access the United States healthcare system for a number of reasons. One of those reasons being that Black individuals are more likely to be uninsured or underinsured. So we end up facing, financial barriers to access care, such as like high deductibles or co-payments. It's hard to, come up with a high deductible sometimes when you're living check to check, or even sometimes when you may not be working a full-time job. You're really making things work on a part-time job. So when you're unable to access health care, of course, what does that lead to? Delayed care. Yes, yes. So when you have to deal with delayed care, meaning that basically, someone who might have a certain type of insurance or a certain type of money, they might be able to go to the doctor, get the care, get the medication that they need. But a lot of times Black Americans cannot do that because we are uninsured or underinsured. So chronic diseases like diabetes, it makes things a lot worse when you can't attack that when you first find out about it, you know. So sometimes we end up in situations where we are just in really bad shape by the time we are able to access the American healthcare system. So when you talk about, once again, the link in between poverty and poor health, we also have to think about poor outcomes. Diabetes is just one of the chronic conditions. But poverty is going to contribute to poor health outcomes, and it's by increasing the exposure to even a risk factor for a chronic disease like, diabetes or high blood pressure. And believe it or not, I think you'll believe it though. Believe it or not, Black individuals are more likely to live in neighborhoods where there's limited access to healthy food, right? So you've heard a lot of talk about different food deserts, and that is a real thing. So you hear people, give the advice like, oh yeah, eat healthy, da 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 da. It's easier said than done sometimes when you don't even have access to healthy food. And then let's talk about safe spaces. Like sometimes in different neighborhoods, there's not even a safe space for physical activity, right? So you're scared to walk, you might be subjected to violence or dogs or anything. And then we're talking about environmental toxins and pollutants, like what happened with the situation with the water out in Michigan. There's just so many factors that Black Americans have to deal with. I don't think a lot of people conceptualize. And I don't think a lot of people understand the connections. But all of these factors are going to contribute to, chronic health conditions. I already mentioned diabetes, but let me mention heart disease. Heart disease is the #1 killer of African Americans in the United States. Let me mention stroke. Let me mention cancer, right? These are all chronic conditions. And Black people, we're more likely to die from these conditions than our white counterparts. Poverty has a role in all of this. When people don't have money, it's hard to find healthy food. It's extremely hard. And I'm not making this a simple issue. I'm not saying that this is, something that is not going to take a lot of work to fix, because the impact that poverty has had on the whole healthcare system is super complex, right? It's not just a linear thing that we can look at and say, okay, well, here's a solution. But what I'm challenging people to do is to understand that poverty does play a part in people's healthcare. We've got to address this issue. And I mean, we got to talk about how are we going to expand access to affordable health care? And how are we going to reduce poverty? Why is there so much poverty in certain populations of people? Is it because they've been locked out of jobs? Is it because they're unable to access the banking system? It's just so much that goes on to contribute to health disparities, and I'm lifting my voice to talk about it. It's one of those things that needs to be talked about even more and needs to be pushed into the forefront. I don't think it's something that needs to continue to be overlooked. We talk about people having poor health and health disparities, but we don't talk about the money. Let's start talking about the money, okay? This is me just literally voicing my opinion. I think we need to start bringing these things to the forefront. Poverty affects healthcare for Black individuals. It does. I don't care how you spin it. I don't care what you say. This is a fact. This is a fact. Take time.